Starting off with Unit 13, Assignment Number 1, right away we have another lecture video from Professor Gernsbacher titled Internet Addiction. This lecture was pretty interesting because it delved into more of like the positive and negative sides of the internet. Over time, we have seen people spend more and more time with the internet, and I mean, it is, I think, a reasonable cause for concern because, addiction is a very real issue that affects a lot of people within our society. And so, kind of considering how people could spend so much time on the internet, on their phone, I think is an important thing to look at because it could potentially be like a very problematic issue that is worth researching and looking into. But ultimately, throughout this lecture, we see the professor kind of dismiss this topic and instead claim that it's really hard for us to know whether or not you can be addicted to the internet. But what we do believe is that there might be specific addictions that the internet enables. So, like, for example, there are definitely people who are like addicted to gambling or addicted to shopping or like addicted to pornography. But the reality is that the internet does not create these things, it just gives people access to these things. So, can we even really call it internet addiction then in the first place? Like, if we took away the internet right now and we ended it, like the whole system, there would still be gambling. You could go to places and gamble your money away. You know, it's just that the internet makes that easier. So, in that sense, it's kind of, it doesn't seem right to think that internet addiction is such a thing. Technically speaking, I guess you could make the claim that it is a matter of using the internet to access these resources. So, it is, in a sense, internet addiction. But ultimately, I kind of agree with the idea that it's just a means to access these things, and it's not really accurate to say that anyone is addicted to the internet at all. After this, we read an article by the Pew Research Center from 2022, and in this report, they noticeably mentioned that similarly to like the lecture video that the professor put up, that internet-based gambling is the least frequent form of gambling, and that in-person gambling is considerably more frequent. So even here, this would kind of suggest that even though it is convenient, that ultimately it's not anything to do with the internet that people are actually addicted to. Rather, it's the act of gambling itself that people like look for. Next, we were told to imagine a scenario in which a friend of ours asks us, after learning that we're in a course titled Psychological Effects of the Internet, about whether or not this class focuses on internet addiction and other negative effects of the internet. And I would respond to this person by just telling them honestly that we do discuss addiction. It is a part of the course, but that it is certainly not the focus of this course. I mean, we're on Unit 13 of 14 here now, and we're only just starting to talk about addiction, so I certainly would not call it the main sort of focus of the course because I don't think that's accurate at all. And then there were 4 different points from the main lecture video that I thought did a good job of kind of showing this. The first one being that just because people use a new technology a lot doesn't necessarily mean that they're addicted to it at all in the first place. Like many people first thought that other people were addicted to books like dime novels back when they came out. And as they were mass produced and easy to get, it just became super common for people to tap into these books and to read them and to just sit with them and sit with them. But ultimately, these books have been shown to be harmless, and the same is likely true for the internet. It's kind of unrealistic to believe that just because it's something that people spend time with, that automatically that means that it's some kind of addiction. In a similar vein, talking on the telephone and listening to the radio were also considered to be addictive activities when they came out. But again, as time has gone on, we've seen that this is largely not true, as these activities are harmless. And then I would also say that it's unsure whether or not internet addiction is a real thing in the first place. There is a chance that because the internet is generally a medium for content and not like the actual end itself, that people might just be addicted to the thing that they're using the internet to find and not the actual internet itself. So it's kind of hard to say definitively if they're addicted to the internet or whatever it is that they're using the internet to find. And then finally, I would say to my friend that psychology is a very broad field and that it explores more than just addiction. And I mean, there are positives and negatives to every argument and like every kind of little different thing that psychology explores. So it's really not fair to say that, the internet is this horrible, like addicting place and that, we're all trying to like figure it out, because that's not true necessarily. But otherwise, that was everything I had to say about assignment number 1. Moving on to assignment number 2, we first review the randomized control trial. This is again just the idea of, if we're having different treatments for different groups, then we want to make sure that we're getting people who are like randomly put into these groups so that bias doesn't arise when we're actually testing them. We can really make sure to try and eliminate selection bias by undergoing this randomizing of groups. After this, we were shown a series of about 26 different articles, the different titles, and this ranged from things like internet-based CBT for somatic symptom distress, ISOMA in emerging adults, a randomized control trial, effects of an internet-based self-help intervention for psychological distress due to COVID-19, to even audiologist-guided internet-based cognitive behavior therapy for adults with tinnitus in the United Kingdom. As you can kind of tell, the common thread running through a lot of these different readings was about how the internet could be used as a way of kind of delivering therapy or other like health-related materials to people struggling with like different issues or different kind of things that, would normally require therapy. Ultimately, I decided to read the article Web-Based Alcohol Screening and Brief Intervention for University Students, a Randomized Trial by Kipri et al. In order to kind of talk about this article, we were given a series of questions to answer. So first, just talking about what was the internet-based intervention. I said that in this reading, the internet was used to supply a treatment to college kids. They were surveyed about their drinking habits, and afterwards they were told about many of the dangers related to drinking, such as related health issues and motor vehicle accidents. The second question was, how was the internet-based intervention conducted? I said that the survey and the information that were given were both sent over the internet on a web questionnaire. And these went to different students that kind of worked at this university, or I should say attended this university. So this was just kind of pulling right from the student pool. Who were the participants? Just kind of what I was talking about a second ago. Participants were college kids aged 17 to 24. And they were just kind of, readily available to the people running this survey, you could say. And then what was the control or comparison condition? The control group was not given the information about the potential adverse health outcomes related to alcohol consumption. They were only just kind of questioned about their identities and their drinking habits, and they were later pulled again later, but they were never told anything about why maybe they should stop drinking. And then what did the study find? The study eventually found that the treatment had hardly any effects at all on drinking habits, next to none actually. The only difference that was found was that there was a modest reduction in the amount of alcohol that these college kids would drink per the typical drinking occasion. But interestingly, the actual overall volume that they drank didn't significantly change. It was just in those typical hard drink binge moments where they found that there was a slight reduction. But other than that, there was very little change. The next question asks, if the internet-based intervention was successful, what factors contributed to the success? And then conversely, if the internet-based intervention was not successful, like mine, what factors contributed to its lack of success? And I just said that I believe that because the interventions that I saw in my study were largely unsuccessful, I feel like this was probably because the messaging that was done, telling students not to drink so much, it was very basic in nature, and it came from a machine, and it was self-paced text that they could just kind of skip through. So it just didn't do a lot to really convince these students to change their behavior at all. It was just very simplistic in nature, and there wasn't much of a follow-up. I think personally that if you want to change someone's mind about something, it's a matter of sitting them down with more emotionally kind of charged material, or having a real conversation with them and talking about consequences. And I just don't think that's something that can really come across, with a simple little bit of cautionary text saying oh, don't do this, or maybe you shouldn't do this, or think about this, So I think that maybe if they had kind of upgraded their sort of intervention to be a little more intense, then I think that they would have seen more of a change in kind of results. And then finally, it asked me if I had any personal experience with the area that this intervention was designed to treat. I would say that throughout college, I will regularly drink with my buddies now, but I try to cut back too sometimes. In more recent times, I try to cut back more just because I don't have as much fun drinking, I think, as the average person might. So I just kind of pull back generally. I can't say specifically if we're talking about alcoholism or anything like that I have much experience with that. I don't really know anyone who I think has been diagnosed as an alcoholic. And if I do, they haven't really opened up about it, so I can't say that I have much of a personal experience with that kind of area. But I did kind of think that it looked like an interesting reading, just because I think alcohol is something, especially living in Wisconsin, that is very relevant to kind of like the culture. And so I was just interested to really like learn more about it and dive into like, like how do people react to kind of people who tell them maybe to pull back, or, what are the kind of effects that we see on drinking habits, when we try to change them. That was everything I had for assignment number 2, though. Moving on to assignment number 3, we first read the definition of cognitive behavioral therapy from the Mayo Clinic. And it goes that cognitive behavioral therapy is a common type of mental health counseling psychotherapy. With cognitive behavioral therapy, you work with a mental health counselor, such as like a psychotherapist or a therapist, in a structured way, attending a limited number of sessions. Cognitive behavioral therapy helps you become more aware of inaccurate or negative thinking so you can view challenging situations more clearly and respond to them in a more effective way. And then finally, cognitive behavioral therapy can be a very helpful tool in treating mental disorders or illnesses such as anxiety or depression, but not everyone who benefits from CBT has a mental health condition. It can be an effective tool to help anyone learn how to better manage stressful life situations. I've heard of cognitive behavioral therapy before in other psych classes, and I do hear it kind of recommended pretty often as being a way to sort of kind of work through your mental health issues. And even as this definition stated, like, it doesn't have to be about mental health issues either. It can just kind of be about like growing yourself as a person and growing into yourself and really just figuring out like, like what you really are worth, and kind of, feeling like you are like the sense of belonging, and that you can kind of control your environment, and that you have more tools available to you than you realize you do. But after this, going back to the main assignment, we watched Mind the Mental Health Charity's 2015 video, What is CBT? Making Sense of Cognitive Behavioral Therapy. And then after that, we read the abstract of Edelman et al.'s 2014 article, Therapist-Supported Internet-Based Cognitive Behavior Therapy Yields Similar Effects as Face-to-Face Therapy for Psychiatric and Somatic Disorders, an Updated Systematic Review and Meta-Analysis, which was originally published in the journal World Psychiatry, and it actually examined 16 different clinical conditions. And then finally, we also read about a brief little handout from YouWill, which is actually a service that we have right here on campus for UHS mental health services. We're partnering with YouWill to expand access to flexible, no-cost virtual counseling options for students. And this is a way to talk to like licensed mental health professionals who are available to kind of chat with, and to sort of get an opportunity to have yourself looked over in like a mental sense, and just really check in on yourself. And I think that's super great. I'm glad that we have that resource, because I think it's easy to kind of push off certain like health related checks anytime there's any kind of like cost associated to them. So having a way to get into that for free, I think, is really great. But anyways, going back to the sort of different little readings I kind of skimmed over. First of all, Mind the Mental Health Charity kind of just talked about CBT a little more, and like the different ways that it can be used, and the different sort of effects that we see, and just kind of again diving into it a little more and talking about how like a therapist who does CBT can help you to kind of break out of negative cycles, or how it's also not like a one size fit all thing. Like, just because you can use it and it's available to you doesn't mean that it's necessarily going to help you. And then after that, the Edelman article, kind of, they did a study where they looked at internet based like CBT, and what they found was that it actually had quite a few advantages. In fact, it was actually shown in many instances to be just as effective as like gold standard face-to-face cognitive behavioral therapy, which is really interesting actually, because this could be a super convenient way for therapists to kind of like engage with clients and provide them with support that is like just as effective as anything they might get from like an office setting, which is super powerful. Then for this assignment, I was tasked with telling at least one other person what cognitive behavioral therapy is. That meta-analysis shows that internet-based CBT is as effective as like face-to-face CBT, and is more effective than doing nothing, certainly, and that there are several like free like CBT resources that are available, especially online. And I made sure to do this too. I sat with a friend of mine and we talked about it for a bit, and they were actually pretty surprised to learn that there was such a thing as like a free way to access it. I mean, free is really hard to come by, in this day and age, so they were happy to learn about that. And then I was tasked with telling at least one other UW-Madison student that UWill is a free, no-cost internet-based therapy, and also that students can get in quickly to see a counselor with appointments, usually within 24 hours. And kind of similarly to my first friend, they were really surprised to learn that like there are ways to get access to resources that aren't like super costly or like with a bunch of barriers set up in front of them. Because usually, I mean, therapy gets like it can be hard to access at times because there can be such a demand for it. So to see that there is such like resource availability is really cool, and they were really happy to learn about that. And then finally, this third assignment ended with me making a post where I posted the following 5 statements. I just typed them out word for word, but I said that 1, I understand what cognitive behavioral therapy is. 2, I've read the abstract of a meta-analysis that shows that internet-based CBT is as effective as face-to-face CBT and more effective than doing nothing. 3, I know that several free CBT apps are available. 4, I've told one other person what CBT is. The meta-analyses show that internet-based CBT is as effective as face-to-face CBT and is more effective than doing nothing, and that several free CBT apps are available. And then finally 5, I told one other UW-Madison student about UWill. I kind of like this discussion board post because it really highlights the fact that Professor Gernsbacher is really just kind of concerned with, making sure that we realize that these resources are available. And, it wasn't really about like necessarily setting out to like prove some kind of knowledge. I mean, it was, but not in a sense of like how it relates to a class or like something we're going to be graded on. I could really tell that this time around it was really a matter of just kind of making us aware that we had access to these resources that were about wellness, and I respect that a lot. I thought that was super cool to see. That just means a lot to me as a student who knows, like, just talking with other people, what it could be like to kind of have these different mental health struggles, and just knowing that there are resources out there is a super big deal, and I respect that a lot. But anyways, that was all for assignment number 3. Going into assignment number 4, we are headed back to assignment number 2's discussion board to look at the posts that have been made by the other students. I started off by reading through all these different posts. I set out to find one that was the same as the article that I read by Kipri, and I set out also to find another one that was by an article that I had not originally read. I did manage to find a post that had been made by Amelia where she talked about the alcohol screening and brief interventionism for university students. She talked about a lot of what I talked about for the study, like how they kind of sat down these different students and kind of learned about their alcohol habits and gave them some the intervention and some didn't get it, and how eventually they saw that the intervention really didn't do much to change drinking habits. It wasn't that effective. Going back to Amelia's original comment though, I made sure to compliment her on the thoroughness of her response. I thought she did a great job of providing plenty of information to answer all of the questions thoroughly, and I especially liked how she went into depth when she was talking about the findings of the study, as like I thought they were a bit confusing, especially the part where it talked about how like the amount of alcohol that was drank during like big binges was less than usual. The binges were like just kind of less powerful than they were before, which is good, but ultimately they found that like overall volume drank didn't change. I thought that was a bit confusing, but Amelia did a good job of kind of explaining that set of findings. But just really working over those kind of intricacies, I thought she did a good job. And then I also made sure to comment on the end of her post where she discusses reasons why the online intervention may not have been effective. I also found that the brief intervention was kind of weak in regards to the fact that the participants only really saw it once, and there was like a simple kind of message on like a computer screen that they potentially just skimmed over. I mean, there's no real way to know that they read it, I guess. I in the end was not very surprised to hear that this intervention wasn't very effective, and I was kind of glad to see that Amelia felt the same. I felt like I could just kind of connect with what she said about how it didn't seem like it was really going to be that effective because it wasn't that strong of an intervention, and truthfully, I agreed with that. I didn't think it was very impressive in a sense at all. Next, I went to find a post that was made that had information that was different from mine, and eventually I stumbled on Nicole's post, and she talked about how for this assignment she read the article titled Self-Compassion and Body Dissatisfaction in Women, a randomized controlled trial of a brief meditation intervention, and this was by Eleanor Albertson, Kristen Neff, and Karen Dill Shackelford. Now, she described how in this study, the internet-based intervention was used in the study, and it was actually a 3-week self-compassion meditation program that was delivered through online audio podcast, kind of like this one, haha. Participants received new 20-minute guided meditations every week and were asked to listen once per day. There were a couple hundred participants in the study who were adult women aged 18 to 60, and they had all reported some kind of body image concerns at some point. Now, they were recruited through websites, social media, advertisements, and other platforms to be in the study. And the study actually used a waitlist control group for comparison, and those women did not receive the meditation. So they just kind of went about their 3 weeks as normal. And eventually the findings found that women who completed the meditation experienced significant increases in self-compassion and decreases in body dissatisfaction compared to those in the control group. And then Nicole goes on to talk about how she thinks that the intervention was successful because it was easy, accessible, and convenient, and that it had a positive effect on women's mental health. If the intervention was not proven successful, then she said that she thinks that a factor that could have potentially contributed was that it was self-guided audio meditation, and that if people don't have any time to be alone, it could be difficult for them to kind of get involved in this sort of meditation and to really kind of interact with it the intended way and to really, I guess, grow from it. Nicole then said that she did not have any kind of personal experience with body image specific meditation, but that she liked doing yoga and meditation and always found tranquility in these activities, and that she believed that they were helpful for her stress and her mental health. But overall, I thought her synthesis of this article was pretty good, and just reading about it, I feel like I got a really good kind of clear picture of how that whole article kind of worked together and played out and what it all meant. And I made sure to show this in my comment on her post. I started off with a compliment by saying that I thought her description of the actual intervention and the whole study itself was really well done. Just because even as someone who didn't read the article, reading like this 200 something word kind of analysis of it, I felt like I had almost read the article just because I feel like I gained the most important knowledge pretty easily from her own little synthesis of it. And then I just wanted to kind of comment on the findings of the research as well. I thought it was cool coming off of mine where, there was no real finding from the treatment. There wasn't much of a change. I thought it was interesting that hers was the opposite and that there actually was a change in positive affect. That was cool to see. We always like to see that. So, I just thought that was fun. And, just kind of, I also wanted to connect a little bit to what you said about doing yoga. I wouldn't say that I'm a big yoga person myself. I've done it in the past and I would do it again in the future, but it's just also kind of something that I prefer to do in private. And I understand the feeling of kind of peacefulness and tranquility that comes with, having your own space and doing it, when there's not other people around and getting your chance to just kind of appreciate the silence. I could totally connect to that. But otherwise, after commenting on those 2 different posts, I was all done with assignment number 4. Moving on to assignment number 5, it was finally time to meet with my online group chat again. Sadly, this was going to be the last time I ever met with my group chat, so I was kind of looking forward to it in a sense, but I was also kind of bummed that I was going to be able to talk with my group anymore, because over the course of the class, it was nice to kind of get a chance to interact with a certain group repeatedly and to sort of talk to them and get to know them a little bit. But prior to actually starting the conversation, we all had a set of CBT self-help articles that we went through. The first was by Boyes from 2013, titled "Try These Cognitive Restructuring Exercises to Improve Your Mood and Reduce Stress." The second was by Anxiety BC's, that one didn't have a date, but it was titled "Self-Help, Cognitive Behavioral Therapy, Realistic Thinking." And then finally was Hubbard's article, "Procrastination, Getting Unstuck with CBT." These articles, as you could probably tell from the titles, were all really based on the power of CBT and how, there is a way that you can kind of bring it into your own life and apply it to what you do to kind of bring peace to yourself and just really kind of almost in a sort of what we were talking about earlier with yoga, it's a sort of beyond the body kind of way to really just feel more confident in your environment and feel more at peace and sort of look into yourself and maybe kind of find a way to overcome sort of a mental block that you've been having recently. As they talk about with procrastination, for example, I know that can be a hard thing, especially as a college student. I struggle with that often. But CBT is definitely a way to kind of look at your issues and think about, what maybe another way to tackle them is, or if there's really any reason for you to have as much anxiety around them as you do in the first place, which I think is a super important thing to consider. Now, once we actually started this group chat, we all started by talking about what kind of progress we'd made on our term project and just what it was looking like in the first place and how we're feeling about it more generally too. And I mean, just going around in the circle, all of us, me, Taylor, and Sydney, we all kind of talked about how we were coming up on the end of our project. We'd had at least the majorities of our projects done. And the two of them, my two group mates, actually also decided to do the deep dive. So their process was a little different from mine. But talking with them, I was able to learn that they had written up a lot of their content already and that they knew exactly what they wanted to talk about for a while. And, it was just kind of a matter of finishing up the little different bits that they had been putting together. Taylor talked about specifically how her presentation was going to be her final project. So it was a matter of really just putting together a bunch of slides and then having something to present. And then Sydney also talked about how for her project, she's got a video that she's putting together. And at the time, she was struggling a little bit with inspiration, but she knew kind of generally what she wanted. She said she was almost done. So generally, we were all looking pretty good. Just a few little maybe obstacles, but nothing too crazy. Nothing that we couldn't work through. No one really seemed like they felt too overwhelmed or stuck on anything. It was just kind of a matter of, giving it its time to mature and working on projects as they come. The next part of our chat was more interesting, though, I would say, because for each group chat member, the other members of the chat helped to kind of set up that first chat group member, apply the cognitive restructuring principles that we had talked about, the realistic thinking recommendations, and the SMART goals that were outlined in the 3 articles that we read before the group chat. We were working to help each member of the chat group arrive using the principles and recommendations we read above at a productive emotional place for completing this term project. And then if we did have a chat member who wasn't feeling overwhelmed or anxious or anything, we were supposed to ask if there was another course project or exam for which they were kind of feeling maybe a little uptight about, and then apply those principles in that kind of area and recommendations there to sort of help them out. Because we were all feeling just a general stress around final season in general, we decided that it would make more sense if maybe instead of focusing on individuals, we just kind of tackled our shared fears for finals and feelings of stress together instead of working through each person individually. But we still made sure to apply all the different principles. So for example, we talked about for how all of us, we could use the cognitive restructuring techniques to feel less stressed. Specifically, we could suggest that we use, or it was suggested that we all use self-compassion and talking to ourselves kindly to make sure that we're not being hard on ourselves or kind of being unfair, and just kind of being understanding towards ourselves and our behaviors and how we're feeling in these times, because these are stressful times. So it is important to remember that we are powerful and we can do this stuff, and just being positive towards ourselves and building ourselves up and not tearing ourselves down. And it's important to kind of look into that cognitive restructuring or sort of reworking our thinking to kind of, create positive spaces for ourselves and kind of tricking ourselves almost into being good instead of maybe allowing ourselves to fall into negative thought patterns. And then talking about SMART goals, a SMART goal is something that's specific, measurable, and then it's attainable, realistic, and timely. So basically just being really specific about making a goal for yourself in such a sense that how to follow it and you know what you want and you know what success looks like. So for our kind of shared anxieties around finals, we came up with a SMART goal where we said that we could all work on our projects for 45 minutes tonight, starting at 8:05 p.m., focusing only on the final touches and finishing thoughts for our final projects, which is good because, it's very specific. We're talking about what we want to do and when we want to do it. And then, not setting ourselves up for failure by saying something like, oh, we want to work for 3 hours straight or doing the whole thing, but instead giving ourselves just a simple little split of time to work with. And then finally, we ended on the principle of realistic thinking, which is basically just the idea of kind of working through things in a sense of if we're just kind of thinking about things on the most basic level, the reality is that even if we do fail, which we're not going to fail, it's not likely, but if we did fail, what would be the worst possible outcome of that? Life goes on, and it's just sort of a matter of realizing that at the end of the day, it's all going to be okay, and you just got to work through it because, if you do your best, you're going to be okay. But more specifically for ourselves, we said that an example of realistic thinking that could be applied would be to say something like, we've done exams and papers before, and we know that we're more than capable of like doing good on them again. To some extent, like a test is a test is a test is a test, and as students, we're very like kind of well adapted to the space, and so there's no real reason to believe that suddenly we're gonna like fail or flunk out or whatever. So just kind of giving ourselves the credit of like we've done this before and we know what we're doing, and like it's okay. We might be stressed now, but there's nothing really to be worried about because it's gonna work out. Otherwise, though, that was the end of our little chat session. We made sure to say our last goodbyes, and then we assigned the different jobs of like creating the summaries and whatnot in the PDF. With that being said, though, that was the end of assignment number 5. Starting with assignment number 6, right away we went into the Unit 13 course review sheet, and first we were asked to briefly explain why psychiatrists and media studies scholars are unsure whether there is such a thing as internet addiction. And kind of circling back, I answered by saying that people fear a lot of new technologies, and a lot of people invest a lot of time in these new technologies as well. And eventually this fear usually leads to the belief that said technology and the time we spend with it is like an addictive kind of relationship, even if this isn't necessarily true. And then when we're talking about like the internet specifically, we're not yet sure if it really is addicting, because for example, like people used to think that reading was an addicting behavior, but like after it's sort of settled down and we've had more time to study it and really learn about it, we've come to learn that this is not the case and that reading is not addictive for you at all. And then also I briefly described what cognitive behavioral therapy is. I just said that cognitive behavioral therapy is a kind of mental health therapy that is used to treat mental health conditions. You work with a therapist to consider your negative ways of thinking and become more aware of them so that you can manage said negative thoughts. It can also be used as a general tool to manage the negative stressors that affect people in daily life. So again, just kind of emphasizing, its status as like a tool that can be used to sort of overcome like different mental hurdles. And then finally, there was another question that asked, does internet-based cognitive behavioral therapy work as well as in-person administered cognitive behavioral therapy? And the answer to this was yes. Yes, we actually found that it typically does. That was the end of my work with the course review sheet for this unit. I made sure to do a little more term project. At this point, we had the opportunity to turn it in. I didn't want to do that just yet. I wanted more time to work on it because I knew I was going to be busy with like finals and papers for other classes. So I kind of pushed this off for the time being. But I did take this as a time to just put a little more work into it by, working on my journal and recording more for my podcast. And then I made sure to put together my 200-word summary where I talk about my project, my medium, and just the work that I've put together on it so far. And then once I was done with all that, I uploaded my submission for Unit 13 and assignment number 6. And then it was time to move on to the final unit of the class. And at this point, I was feeling pretty good because it was kind of cool to finally see like the end of the tunnel, I guess. But anyways, that was the end of Unit 13.